Icatibant is a medication used to treat sudden attacks of a certain immune system condition called hereditary angioedema, HAE. It is not a cure for HAE, but it may help lessen the symptoms of an attack such as rapid swelling and pain in various parts of the body. These symptoms may include swelling and pain in the hands, arms, feet, legs, face, tongue, and upper airway. When attacks involve the stomach/intestines, symptoms may include abdominal pain/cramps, diarrhea, constipation, or vomiting. Attacks can happen at any time, but stress, injury, or illness may trigger attacks in some people. Icatibant works by blocking the action of a natural substance in the body called bradykinin, which is thought to cause the symptoms of an HAE attack. It is given as a subcutaneous injection and the dosage is usually 30 mg per 3 ml. The optimal timing for taking this medication should be discussed with a healthcare provider. Before using Icatibant, it is important to read the patient information leaflet and follow the instructions provided by your healthcare professional. It is essential to learn how to recognize the symptoms of a sudden attack of HAE and consult your healthcare professional if you have any uncertainties. Before injecting each dose, it is important to visually check the product for particles or discoloration. If either is present, do not use the liquid. Clean the injection site with rubbing alcohol before injecting each dose and change the injection site each time to lessen injury under the skin. Icatibant should be injected under the skin in the stomach/abdominal area as directed by your doctor, usually over at least 30 seconds. If your symptoms continue or come back, you may give another dose after at least 6 hours, with a maximum of 3 doses in 24 hours. In the event of a sudden HAE attack of your throat area/voice box/upper airway, larynx, it is important to administer an injection of Icatibant and seek medical help immediately, as this type of attack may lead to a blocked airway and serious breathing trouble. It is also important to learn how to store and discard medical supplies safely and to inform your doctor if your symptoms do not improve or worsen. Side effects of Icatibant 30 mg per 3 ml subcutaneous syringe bradykinin B2 receptor antagonists may include fever, dizziness, and reactions at the injection site such as redness, burning, swelling, bruising, irritation, or pain. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist for further guidance. Before starting Icatibant, make sure to inform your healthcare provider if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history with your doctor or pharmacist before using this medication. Icatibant may cause dizziness. Avoid consuming alcohol or marijuana, as they can intensify this effect. Refrain from driving, operating machinery, or engaging in activities that require alertness until you can do so safely. Limit your alcohol intake and consult your doctor if you are using marijuana. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, over-the-counter drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor before using Icatibant. It is not known whether this medication passes into breast milk, so consult your doctor before breastfeeding. When taking Icatibant 30 mg per 3 ml subcutaneous syringe bradykinin B2 receptor antagonists, acute, it's important to be aware of potential drug interactions. These interactions could affect how the medication works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including both prescription and non-prescription drugs, as well as herbal products. Make sure to share this list with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without first consulting your doctor. If someone has taken too much Icatibant and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. This medication is not meant to be shared with others. Icatibant is used to treat sudden attacks of hereditary angioedema, HAE. It works by blocking the activity of a certain natural substance in the body, Bradykinin, that causes symptoms of HAE. This medication may help increase your ability to perform daily activities. This medication is given by injection under the skin on an as-needed basis by a healthcare professional. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. The dosage is based on your medical condition and response to treatment. For the best benefit, it is important to use this medication as directed. When storing Icatibant 30 mg per 3 ml subcutaneous syringe Bradykinin B2 receptor antagonists, acute, make sure to keep it at room temperature in a cool place or in the refrigerator, but do not freeze it. It's important to store this drug in the manufacturer's carton until you are ready to use it, and to keep all medications away from children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. It's important to properly discard this product when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.